I'm sorry, I got cut off. So this is part two. What I was saying is, depending on the state that you're testing for, if you're in a state that sees a whole lot of certain disease processes, expect to see a lot of those disease processes on your NCLEX. Remember, this test is to see if you meet the minimum competency levels to see the type of patients that you're most likely to see in that state. Do you see what I'm saying? You're not going to get a question on NCLEX that only 1 in 10 million people ever see. That is a waste of a test question. I'm going to tell you this right now. It takes hours and hours and hours and hundreds of dollars for one single question to be formed for NCLEX. So they're not going to waste it on a disease, a medication, a diagnostic test that only 1 in 20 million people ever see. They're going to use it on something that you are very likely to see in practice. So it depends on what state you're in. But there are certain diseases and disorders. It doesn't matter what state you're testing for. The chances are very high that you'll see those diseases and disorders. What am I talking about? Diabetes, hypertension, hyperthyroidism, hypothyroidism, ICP. There's certain things you're going to see everywhere. High cholesterol, right? Osteoporosis, STDs, cancer, peds, maternity, things like that. So I encourage you, go to my YouTube channel, go to my NCLEX playlist, and start watching the videos that I made specifically for LPN students. Start there. And once you finish all those videos and you know those topics very, very well, then go ahead. Why not? If you have the time, start watching the ones I made for the RN. You'll see a lot of information that you see I talk about over and over and over and over again. There's a reason for that. The reason is it's very likely you're going to see that on your board. So I'm drilling it into your brain. I'm making you see that information in 10 million different ways, 10 million different questions. I'll talk about it and I'll lecture about it in 10 million different ways because it's very important for you to know, and it's very likely you may see a question about it. So I hope this helps.